Welcome back. Continuing the news. November is Diabetes Awareness Month. Medical experts say after all these years, there is still a challenge tackling obesity in diabetics. Shamela Pullen tells us more in this week's edition of the Health Report.
According to the Pan American Health Organization, PAHO, 54% of Jamaicans are overweight or obese. This is becoming a significant health issue, especially amongst persons who are diagnosed with diabetes. Consultant General and Bariatric Surgeon Dr. Lindbergh Simpson says, with diabetes more prevalent in the population, it is more difficult to control obesity.
Patients who have a BMI greater than 30 are considered obese. And this is one of the main things. The people who are moderately obese have a BMI greater than 35, and the severely obese have a BMI greater than 40. So this is a real problem in terms of the patients who are at the higher BMIs. If their BMI is greater than 35, the person who is managing their diabetes is going to have a challenge keeping those blood glucose levels normal.
But there are persons who, despite sticking to a particular diet, still fail to lose weight to get their glucose levels under control.
They may have an infection, something not really under their control, a urinary tract infection or a chest infection. And these things will also push your blood glucose levels up and affect their glucose control. So it is not necessarily related to the patient and not being disciplined, but certainly the environment can play a role in the patient's diabetes being less under control.
To tackle the issue of diabetes and obesity, it takes a multidisciplinary approach. However, not everyone would be eligible for surgery.
Obese diabetics who are of Asian descent may get complications at an earlier rate than those who weren't, and there are some recommendations for obese diabetics who are of that ancestry to maybe consider surgery earlier. But when you're doing surgery, you always want to consider the risk-benefit, and certainly for moderate to severe diabetics, the risk-benefit is much more clearly in favor of surgery, particularly minimal invasive surgery.
Obese diabetics are also encouraged to continue to eat a healthy diet and exercise. With your health report, I'm Shamela Pullen, wishing you good health.